patients asking questions around weight loss, stubborn weight loss, inflammation, why they feel like they've tried everything and they can't get the weight to go down. And the thyroid can often be the missed piece of that puzzle. But if your T3 is low or reverse T3 is high, your body is literally fighting against fat loss.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. I am your host, Dr. Alessi, and today's episode is going to be focused around what we are calling the hidden thyroid weight connection. Now, this is a topic that I really have been looking forward to digging into for a while, and something that's been a little bit more prevalent as of late. Patients asking questions around weight loss, stubborn weight loss, inflammation, why they feel like they've tried everything and they can't get the weight to go down. And the thyroid can often be the missed piece of that puzzle. And so we're going to take this into a 4-segment part episode. That way you know what to expect. Segment 1 is we're going to talk about why the thyroid controls your metabolism, what the thyroid is, how it works. Segment 2, we're going to get into what are some symptoms or red flags of thyroid and weight dysfunction. Then we're going to talk about how we test the thyroid in functional medicine, not just with basic testing, but comprehensive labs. And then we're going to pull it all together and talk about how do we fix the thyroid and weight connection in functional medicine. And so thank you for joining me today. If you've been listening to the show for a while, you know that we're just here to decode the myths around health, provide value to our listeners, and help educate and impact those to go spread the word to others. So if you've enjoyed the show, please share, please follow so you can stay informed, and then share this with someone that you know could benefit from the information. So let's get started here. Okay. So if you're not familiar with what it is, your thyroid is a small butterfly shaped gland that sits right in the front of your neck. And it's small, but it's the master regulator of your metabolism. And in functional medicine, we call it the thermostat. It basically controls how your body burns calories, how much energy you're going to produce, how warm or cold you might feel, and even how sharp your brain is. It even controls the rhythm at which your heart beats. And so every single cell in your body has thyroid hormone receptors. And so when the thyroid is off, a lot of things downstream can be affected. And so the way the thyroid works, right? And we've touched on this briefly in past episodes, particularly in like the gut and hormone episodes, but your thyroid does not work in isolation. It's part of what we call an axis, particularly the HPT axis, which is your hypothalamus, your pituitary gland, and your thyroid gland. And there's basically a chain in which they talk to each other. And so the way it works, your brain's pituitary gland, which is inside your skull, sends signals, which is thyroid stimulating hormone. It sends that signal like a boss giving instructions to the thyroid. What happens then is your thyroid is going to produce T4, which is the inactive storage form of thyroid hormone. Then T3, which is the active form. The body needs to convert to that, correct? Right? So the one that actually enters the cells and tells them to crank up metabolism is your T3. This is the fat burning hormone, right? Now, reverse T3, think of this as the emergency brake. So if your body is stressed, inflamed, or you have a lot of toxicity, it can convert T4 into reverse T3 to try to slow things down. So your body's trying to always maintain a level of balance. Now, most T3 is actually made outside the thyroid in your gut and your liver. And so when people have poor digestion, when they have things like SIBO, leaky gut, inflamed gut, toxic overload, this can actually go back upstream that axis and affect the thyroid and cause dysfunction. And so, when the thyroid slows down even a little bit, weight loss actually becomes kind of like that uphill battle. You could be eating clean, exercising, doing all the right things, but if your T3 is low or reverse T3 is high, your body is literally fighting against fat loss. We always talk about how our approach to fat loss in functional medicine is very much focused on becoming healthy first. Your body is not going to prioritize losing fat or burning fat when there's inflammation and there's dysfunction. It's going to prioritize the fires first. And so there was a study in the Journal of Clinical Endocrinology and Metabolism, 2019, that said even subtle thyroid dysfunction which is high to normal TSH or low T3, is linked with higher body fat and metabolic slowdown. There was also another study out of Lancet in 2020 that said individuals with TSH in the normal but upper range had significantly higher rates of insulin resistance and weight gain compared to those in the lower to normal range. Now, the reason that's important is because standard conventional medicine is going to read a lab within reference range as normal, tell you you're fine, go about your day. They wait until something goes dramatically wrong for them to take action. In functional medicine, we narrow the reference range to be optimal, not just normal. And so a lot of conventional docs, they're only testing the TSH. They're looking for TSH and maybe T3 or T4. They're not checking reverse T3. They're not checking the antibodies that could be causing the thyroid to be, your body to be attacking its own thyroid tissue. And so that's where we must take a deeper look. And so I want to use an example, what we call like a patient case example. And I'm not going to use any names, but basically had a patient. She was 38 years old. She was working out often, honestly, like 5-6 days a week, maybe more than she needed to be. And she was eating what we would consider a clean diet, but she was very exhausted, fatigued. She had things like thinning hair, and she couldn't lose weight no matter what she was trying. And so all these signs, obviously, the first thing I was thinking was hormones, thyroid, let's investigate. She had gone to her family doctor who told her her labs were fine. She brought the labs to me. All they had run was TSH, which was at like a 3.9, which they, still considered normal, but is on the higher range. And then we ran a full panel and we saw that T3 was low, reverse T3 was high, and she had antibodies for what we would call Hashimoto's, which is an autoimmune thyroid disease. And so once we addressed this, we did some more testing and we actually addressed her gut and we found leaky gut syndrome. And so when the gut is inflamed and damaged, it can cause what's called leaky gut, or basically intestinal permeability. The gut is starting to break down. And so we had to not just go straight for the thyroid because, standard medicine is going to put medication in you to focus on the thyroid. We had to go to the gut first, right? What was the root cause? So we worked on balancing the gut, fixing the gut issue, then supporting the thyroid on the back end. The symptoms went away. Obviously, that was actually the first thing that happened. But then upon retesting, we found that the panel got better and the TSH was back down in normal range, optimal range, I would say. And the antibodies weren't gone, but they were starting to go down as well. And so then now for her, it was just a matter of supporting that and maintaining that lifestyle that we had incorporated. So that's just an example of what can happen, right? And why functional medicine takes a deeper look and why we focus on things like that. Now, let's get into the next piece here where we can talk about like what symptoms or red flags you can expect or should be looking for with thyroid weight dysfunction, we call it. And so some of the common hypothyroid symptoms, hypo meaning slow or low thyroid, are things like weight gain, especially like stubborn belly fat, even when you're eating clean and working out. Cold intolerance, if you're always needing a sweater when other people are comfortable. Chronic fatigue, you wake up tired even with enough sleep. You're fatigued throughout the day and you just can't catch up on sleep. Brain fog, very common, is to have like that slow thinking, poor memory, difficulty concentrating, poor recovery from exercise, thinning hair, dry skin and brittle nails, right? Basically like collagen kind of symptoms. Constipation and bloating. So definitely gut issues are very common with a low thyroid. And then in females, irregular or heavy menstrual cycles, more than normal or off of the actual standard cycle. And now the opposite of that is what we call hyperthyroid, hyper meaning fast or elevated, right? So on the flip side, it's kind of the opposite of all those symptoms, right? Unexplained weight loss despite eating enough, anxiety, nervousness, people getting like palpitations, that jittery feeling, insomnia, right? Maybe feeling wired at night, unable to sleep, sweating excessively, heat intolerance, and then frequent bowel movements or diarrhea. These are, again, very much the opposite of the hypothyroid. So there's two different ranges here. And now let's dig into kind of what you could experience with what we call like the hidden culprit, which is Hashimoto's. And I've shared my story many times on here, but this was what I was dealing with. I had a hidden Hashimoto's even with normal thyroid, right? And so my body was attacking its own thyroid tissue. It was just a matter of time that I possibly would go low thyroid, but I was able to get ahead of it. And so Hashimoto's actually accounts for 90% of hypothyroid cases, but it doesn't show up overnight. It takes time for this to build with very vague or even like subtle symptoms that people won't notice. And it can swing between the hyper and the hypothyroid. People can feel wired for bits of time and then exhausted for bits of time. And they're just very much fluctuating on this spectrum. And by the time it gets diagnosed, honestly, usually much of the thyroid tissue has already been damaged. And so in a Journal of Autoimmunity Reviews 2019, autoimmune thyroid disease often precedes diagnosis by years, with nonspecific symptoms like fatigue, mood swings, weight fluctuation dismissed as stress, aging, or just you're being a mom, right? We hear that all the time. Oh, you have kids. This is just normal to feel like this. And so the subclinical hypothyroidism is often linked to increased abdominal fat and insulin resistance, even before full-blown disease developed. So these are just things to be aware of, right? We always say symptoms are not normal. Symptoms are your check engine light. Everybody has a car, right? We drive our car, check engine light comes on. You need to figure out why it's going on. That's what your symptoms, your pains, these dysfunctions are. And so now that we know what the thyroid is, why it matters when it comes to metabolism and weight, we know kind of what to look for, what red flags. Let's talk about how we test this to make sure we're in the right playing field. But first, let's take a quick word from one of our sponsors. Hey, Health Decoded listeners, I'd like to share a story with you. There was this man who on the outside looked healthy, like he had everything going right. He was fit, he worked out, he ate clean. But beneath the surface, even unknown to him, his body was breaking down until one day he crashed. Full-blown fatigue, burnout, he couldn't even think or make it through the day without a nap. After finally turning to functional medicine blood work and discovering he had an autoimmune thyroid condition caused by leaky gut, he was able to take action and restore his health. Well, guess what? That person was me. And that's what led me to tirelessly work toward creating an option for people who wanted a way out. The result was my 6R gut healing protocol. Backed by advanced functional testing, this system uncovers the root of dysfunction and uses a step-by-step formula proven to restore, rebalance, and completely heal the gut. We only open this program to a select number of patients each month. So if you're ready to finally take control of your gut health, visit alessifunctionalhealth.com/gut and take the quiz to see if you qualify for this program. I look forward to seeing you soon. All right, welcome back. Now let's talk testing, because this is where most people are curious, most people want to take action, and where most people get completely missed or dismissed by their conventional doc. And so the reality is that most conventional doctors, as I said before, I'm going to beat this dead horse, they only test TSH and maybe T4. That's like checking the gas gauge in your car without ever looking under the hood, right? It gives you a sliver of the picture, but it leaves patients walking away with a "you're fine, things are normal" diagnosis when they clearly don't feel fine. So our full thyroid testing approach looks like this. At Alessi Functional Health, we're going to dig deeper. So a true thyroid assessment includes TSH, free T4, which is the storage hormone, free T3, which is the active hormone, reverse T3, which is basically the metabolic brake pedal. We're going to check thyroid antibodies, TPO and TG, to screen for Hashimoto's or autoimmunity. And we're going to check total T3 or T3 uptake, which is a deeper look at how your body is transporting those hormones. And so that's not enough still. For functional medicine, we want to test further. We want to look into the gut, because the gut is often associated with these dysfunctions upstream. And so we can do gut testing. We have a really awesome test called the Deep Gut Scan. It's going to test for zonulin, calprotectin, stool panel. That's going to basically look into the system, the ecosystem of the gut. Is the bacteria within balance? Is there leaky gut syndrome? Is there IBD or IBS? We also want to test for micronutrients. So looking at things like selenium and zinc, because these are very important for building the thyroid. These are basically the raw materials your thyroid needs to function. We also test the adrenals with a salivary test because stress and thyroid are basically two sides of the same coin. And as always, we like to test for toxins. Testing for heavy metals, BPAs, pesticides, mold can basically tell us if there's any kind of like endocrine disruption being had from these types of toxins. And so, some of the red flags that we catch that others could miss, things like a normal TSH that's at the higher range, but then free T3 is at the bottom, but it was never tested, right? Or prime example, young mom with low ferritin, positive antibodies, but she was dismissed as postpartum fatigue because they didn't look deep enough into the testing. And so she had the symptoms, but there was not enough testing done to create a diagnosis, which, would be early Hashimoto's in this situation. And so there's a cool study out of Frontiers in Endocrinology 2021 that confirmed that thyroid antibody positivity can precede clinical hypothyroidism by 5 to 10 years. So oftentimes people have the thyroid antibodies building, but the actual thyroid hormones are not being affected yet. And so without full testing, these patients are told they're fine, while under the surface, the immune system is actually silently attacking their thyroid. Again, this is my story. And so, if you're only testing the TSH, you're practicing 1980s medicine. That's what I'd say. Because functional medicine in the age that we live in, we have the ability to test all the things that matter. We have the ability to be proactive and preventative and not just waiting for things to fall apart. And so, speaking of that, let's talk about how we can now transition from taking the data from testing and actually fix the problem, right? Not just cover it up, not just manage symptoms, but fix the actual dysfunction. And so this is where things get exciting. This is usually where people are like, oh, I want to hear this part, right? I want to know what to do. And so there's an appropriate way to do it. And so you don't just slap a medication on it, call it a day, because then you aren't really creating any conditions for the thyroid to actually recover. You're just covering it up. And so functional medicine is root caused. When we say that, it means we're getting to the root of the problem, right? And so oftentimes inflammation is not even the root. It's something causing the inflammation that then is causing the dysfunction. And so we have to really dig deep with our questioning, with our testing, and then come up with solutions. And so step one is always, always, always remove the triggers. Like what foods could be triggering the dysfunction in the gut or in the thyroid? Is it gluten, dairy, processed sugars that are leading to inflammation? So gluten in particular is a known trigger for autoimmune disease. Environmental plastics, things like BPAs, pesticides, heavy metals, endocrine disruptors that block thyroid hormone conversion. And so there was a study, actually, Environmental Health Perspectives 2016, found that BPA exposure was significantly associated with altered thyroid hormone levels in women. And so here's a practical tip. We're always fans of that, right? Is swap your plastic water bottles for stainless steel or even glass, and then going organic when it comes to the foods that are on that dirty dozen list that we talk about. These can make a big impact of not continuing to put the things in the body that are causing the issue, right? Step two, heal the gut, right? So step one was remove the triggers. Step two is going to be heal the gut. If 70 to 80% of your immune system is in your gut, then that's right where autoimmunity starts. And so we use specific tools, specific tests. We actually have a protocol that's 6 months to take you from, you could be completely wrecked to all the way completely healed. Your gut is functioning perfect and normal. And then obviously from there, we target the actual things like the thyroid that need attention. And so then from there, step three, right, what I just spoke to is support nutrition, right? And so we use specific nutrients for thyroid, things like selenium, which reduces antibodies, helps convert the T4 to T3. Iodine, obviously within a specific amount, we don't want to do too much. Zinc and B12 are very important because these are critical coenzymes for hormone production and energy. And then vitamin D is responsible for immune regulation and metabolism as well. And then step four, balance the hormones and the stress. And so we can use certain things like adaptogens, but also prioritizing lifestyle, sleep, exercise, movement. All these things are lifestyle medicine practices to help to avoid flare-ups. And then step 5 is using advanced tools, right? We can dig in and get deep with things like peptide therapy. Peptides like thymosin alpha 1 or BPC 157 can actually modulate immunity and repair tissue. We can work on benefiting the mitochondria, supporting the mitochondria, and then targeted nutraceuticals. We also have access to really cool things called bioregulators. I do a course of bioregulators maybe once a quarter or every 4 to 5 months to give my body the raw building blocks it needs to build back up tissue. And so in particular, the thymolin one. And so, sometimes medication is necessary. I always like to say we're not like anti-medicine. We're just pro doing something that makes sense. And so sometimes medication is necessary. You need to take a course of it, but it's not going to be the fix. And so you can use it for a bit to get you back maybe stable, but getting to the root cause is always going to be the long-term plan, because that's what will actually correct the problem. And so one last little quote here, the American Journal of Lifestyle Medicine 2021 concluded, and this is huge, that lifestyle and dietary interventions remain the foundation of thyroid health, even in autoimmune thyroiditis. And to basically translate that, you can't out-medicate lifestyle. Take all the medicine you want. If you don't change your lifestyle, if you don't change your habits, nothing's going to go away. You're going to be stuck in this cycle. And so really, final takeaway, thyroid dysfunction isn't a weight loss death sentence, but if you don't fix the thyroid, no diet or workout plan is going to get you there. And so you need to start from the root, right? Is it the gut? Is it the thyroid? Is it the hormones? Find out where the problem is, correct that, and then your body will want to prioritize losing weight. And so this is why in our Total Care program, we don't just take a glance. We map out everything. We're going to guide you along the entire process. And so if you would like to learn more about how we help diagnose, reverse, and heal thyroid dysfunction and weight loss through our functional medicine programs, go to alessifunctionalhealth.com. Schedule a consultation with me or one of my other providers, and let's create a personalized plan for you. Listeners of the podcast, you're always going to get exclusive discounts and price reductions on all of our protocols, lab testing, and follow-ups and stuff like that. So be sure to mention where you heard about us. As always, I do ask you, if you found value in this episode, please like, subscribe to the show, and then share this with someone who needs to hear it. That's how we grow the message, and that's how we change more lives, the impact piece. Also, if you want to get in touch with us or be featured on an episode, share your story, email us your questions at ask@alessifxhealth.com. You can also visit alessifunctionalhealth.com, sign up for the newsletter, check out our resources, and learn more about our approach to nutrition and cutting-edge therapies. Thanks again for tuning in to Health Decoded. I'm Dr. Alessi, and I'll see you on the next one.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.